bone broth. How many of you have heard about bone broth? Okay, bone broth is getting really popular again, and for good reason. Nearly every country has what's called a sick food. In other words, when you are sick, this is what you eat. More than 80% of the countries use chicken soup. Chicken soup or fish head soup as their sick food. The other countries use liver. Those are usually the only things that people do. Some have a few little, herbal concoctions that they do, but for the most part, it's one of the two. And some of them it's beef, but most of the time it's chicken soup. And so chicken soup, when I say bone broth, I'm talking about chicken soup that you make at home out of a chicken carcass or a beef carcass, any kind of bone that does not have noodles in it, and it's the broth, okay? For healing your joints, I would be drinking a cup of it every single day without fail. You have the gelatin and the collagen that is needed to repair those joints that you were told will not repair. It has the calcium in it. It has protein in it. Now the protein's not quite as good because, again, it's been cooked, but it's better to cook it at a low temperature for a longer period of time than a high temperature for a short period of time, okay? Do not, how many of you make bone broth? Anybody here? Oh good, several of you do. Do not skim the fat off from it.
Oh, really?
You need that fat. See, it's a good thing I brought this up. Don't take it off. You need the fat to pull the minerals into your bones and into your tissues. Now, if it's, if you've got a quart, it's like that much fat, then yeah, take some of it off.
Just little.
Yeah, it's usually just about that much. That's perfect.
How about chicken?
Chicken, same thing. Same thing. And with your chicken, do not take the skin off. I mean, you probably have already eaten it, but if you take the skin off when you eat, put the skin in your broth, okay?
That's what I do. I clean it up, my chicken and all the bones and the skin, I just make a nice broth.
Good job.
Then I
Good
use
job.
for pilaf though.
Yeah, don't forget that part. There's something really interesting about the body, is we have what's called organ specificity. And what that means is if you have a problem with your liver, you eat liver. You have a problem with your heart, you eat beef heart or chicken hearts. And if you have a problem with your joints, you eat joints. If you have a problem with your joints, if you have arthritis, go to the butcher, ask for some joints. Some people call them dog food because it's a little cheaper. If you just say, I want joints for my dog, it's cheaper than if you say, I want joints for soup. It's exactly the same thing, but it's just a little cheaper, just so you know, a little secret. You ask for joints and you put the joints in your soup. So if you're doing a chicken, you take a carcass, you cover it with water, bring it to a boil, then immediately turn it to simmer and leave it on simmer for anywhere from 2 to 4 days. I usually recommend 4 because you get more of the nutrients out of it. Throw a knuckle bone in there, a joint in there, 1 fur of chicken. And you'll notice when it cools and you put it in the refrigerator, it'll separate. And you'll see the broth, and then you'll see this big layer of gelatin and collagen, all this yummy stuff in there, and then your little layer of fat. That's so good for you.